This is Mulalem Maragawi, an HIV-positive mother. She was a resident of Satit Humera, Western Tigray, until she was forcibly displaced by Amhara forces, along with her husband Brhane Gabramariam and their 8-year-old daughter. Mulalem and her family are currently sheltered in Lekatit Israel Celeste IDP camp in Maqala. She says she and her husband Brhane Gabramariam have been HIV-positive for the past 10 years and were taking antiretroviral therapy ever since. However, they haven't been able to take their medication as the ongoing siege causes the depletion of medical supplies in Tigray.
I was forced to leave my home all of a sudden, and I couldn't bring my regular medication. I haven't taken my medication for 5 months on my way to Maqala. On top of that, it's impossible to get it now due to the siege. I'm currently unable to take any medication. I haven't taken Bactrim since I'm not eating enough to resist it. Since we have run out of our regular HIV medication, we have to go house to house begging for money to try and buy it. Even if I am able to buy some of it, I have to share it with my husband because it's usually not enough for both of us. I'm in a dire situation.
Ever since I have displaced from my home, I haven't been able to take my regular medication. This has made vulnerable to additional disease like tuberculosis. We are barely surviving since the ongoing siege has made it impossible to get medication.
I have been HIV positive for more than 10 years now, and I used to take my medication regularly. Medics say that HIV patients should get balanced diet, and I used to eat proper food so that my body could resist the medication.
I have been HIV positive since 2012, and I was able to live like a normal person because I have had access to medication, food, and anything else I needed.
Mulalem is 7 months pregnant now. She says she fears for her baby as she finds it impossible to get the medication and food she needs for her baby to be born healthy. She also says that her 8-year-old daughter is finding it difficult to survive as getting her food continues to be difficult.
I am 7 months pregnant. There is just too much problem on my shoulder now because I worry for my baby in addition to myself. On the top of my medical situation, we have nothing to eat. The siege is making our lives harder day by day. My condition has further deteriorated because I stopped taking my medication. I have had a major weight loss which made my body very weak. My daughter usually has nothing to eat. She gets a cup of soup if it's her lucky day. If it's not, she goes on empty-bellied. We haven't received any kind of aid except for the 15 kilos of wheat we received 3 or 4 months ago. Life is just getting harder and there is no one to help us. All of this because of the siege.